2011G Group 26. And today, I will be performing a return demonstration of hand washing and gloving. Hand washing is the most effective way to prevent from spreading of microorganisms, and it could reduce the risk of transmission of microorganisms to the client. So to begin, the equipment that we are using are the soap, the sink with the running water, a towel, a trash can, and a paper towel. So next is stand in front of the sink and do not allow yourself to touch in the sink because the sink is considered as contaminated and your uniforms may carry microorganisms from place to place. The next is short nails must kept short because short nails are less likely to harbor microorganisms. And next is remove all the jewelries that you have because microorganisms can lodge in the setting of the jewelries such as wristwatches and rings. Next is turn on water and adjust force. So water that splashed from the sink can contaminate your uniform. So next is wet your hands from the wrist towards the bottom of the sink. So water should flow from the less contaminated area to the most contaminated area. So wrist is considered as the less contaminated area while the hand is considered as the most contaminated area. So next is, by the way, hands must always be lower than your elbow so that the water will flow onto the sink. So next we'll apply soap. So rinsing with soap removes the lather that may contain sweet microorganisms. So first, rub the soap. Then next is the right palm to the left dorsum, then interlace finger. Then next, vice versa. So next with both palm and interlace finger. So next will be the back of the finger opposing from the palm with an interlocked finger. So like this, then vice versa. So next is rub your thumb with the palm like this and do it vice versa. And lastly, rub your wrist. Do it for 30 to 40 seconds. So the length of hand washing is determined by the degree of the contamination. So these circular motions and interlaced fingers can create friction that helps remove the microorganism, while the interlaced fingers can help removes the dirt and the microorganism from interdigital spaces. So next is to rinse the soap with water. So from the wrist to the hands, like I said before, the water should flow from the less contaminated area to the most contaminated area. So the soap and the dirt may flow into the sink. So next is visually inspect for any dirt and remaining soap. Since there is no more, use the paper towel to dry our hands. Drying of skin will help maintain our skin from chopping. And lastly, get a new paper towel to turn off the faucet, because the faucet is considered as a contaminated area, and if you touch it again, we will do the hand washing all over again. So those are the techniques of hand washing. Thank you for watching. So after performing the hand washing, we now proceed in performing the open gloving. So open gloving, the use of gloves is to create a barriers between the hands and the germs. And wearing gloves can protect the healthcare workers and the patient from the infection. Also, gloves can protect the hands from any contamination from the blood or any body fluids. So to start, perform hand washing, which we did earlier. This is to decrease the bacteria in your hands and to prevent contaminating from the sterile gloves. Next is prepare your sterile gloves, then ensure the correct size of it. Then inspect for any leakage or stain that could contaminate the sterile gloves. So check for it. Then next is open the package without contaminating the inner package. This. Any moisture can contaminate the gloves. Next is this. Next is open the inner package according to the manufacturer's direction. So inner surface is next to the sterile gloves, which will remain sterile. So next is to determine the left and the right glove. So open it. So put the first glove on your dominant hand. Since I am right-handed, my right hand will be the dominant hand. So pick up glove for dominant hand by touching the inside cuff of the glove, then pull glove completely over the dominant hand. So like this and like this. The hands are not sterile. By touching only the inside of the glove, we can avoid contaminating the outside. So like this. Now pick up the other glove with the sterile glove hand, inserting the glove finger under the cuff and holding the glove thumb above the glove palm. So insert it from the glove. Then insert the other hand. So, in this position, the thumb is less likely to become contaminated. So, next is adjust each glove so that it fits smoothly and carefully. Pull the cuffs up and slide the fingers fingers in. This is to protect your gloves finger to maintain sterility. Like this. So adjust it. That. Once gloves are in, interlock glove hand and keep it away from contaminated area. This is to prevent the accident touching of non-sterile objects. So, interlock. So, those are the ways on wearing the gloves. Then for the last, remove and dispose of used glove to To remove gloves, grasp the outside of the cuff or palm of gloves and gently pull the gloves off. So, like this. Yan. So, after that, dispose the used glove. That's all. Thank you.